Morning, morning, morning. Good morning. Good morning to you.
Right now we're joined by a familiar face and one that's growing on us, becoming quite familiar as well. So I'll welcome Neil Clark, who is Chief Executive Officer of the Queen Elizabeth Hospital. Good morning, sir. Good to have you with us.
Good morning. Thank you for having me again.
Welcome. Also here is Shane Seeley, Communications Specialist with the QEH. Good morning, sir.
Always a pleasure to be with you, Tisha.
Always a pleasure to have you back on Morning Barbados.
Thank you very much. I appreciate it.
All right. Now, I know that we're getting ready to set the standard, chart a bold path forward with the unveiling of your 2025 to 2028 healthcare strategy. And that includes some engagement with the public. So that's going to start with a town hall meeting that's coming up. Tell us more about that.
So we've got a town hall meeting tomorrow evening at 6 p.m. at the Queen Elizabeth Hospital Auditorium. And we're encouraging as many people as possible to come join us and tell us what they're looking for in their hospital over the next 3 years. We've already done some consultation internally with our own staff and with the Ministry of Health and Wellness, but this is the people's hospital, and we want to get the feedback of as many people as possible into what we've already identified in the draft strategy. In that draft strategy, we cover 5 key themes: healthcare delivery, infrastructure and equipment, workforce, finance, have to be financially sustainable, and ICT, which is the digitisation of the healthcare system. There are 41 objectives that we've identified, 128 initiatives, and we've identified these from those initial consultations and from previous papers, from the balance scorecard, which tells us how well we're doing, where we have some challenges, from patient feedback and from staff feedback. But it's really important for us that we hear from the public about what do they want for their hospital.
Now, I know that you are, kind of out there in the trenches when it comes to communications and engaging. What are people asking for generally when you hear from them, when they reach out to the various services offered by the QEH to be able to share relevant information and so on? What do Barbadians want to hear about? What do they want to know?
At the top of the list is more transparency from the Queen Elizabeth Hospital, which they will be getting through the 2025 to 2028 strategy. But they also want to know how to best navigate their hospital, how to best access the services, and how not to waste time accessing those services. So under the strategy, all of these things are addressed. They'll get a first-hand opportunity when they come to the auditorium tomorrow to hear from the CEO, the executive directors, on a number of different areas. You heard the CEO mention the list of things that will be covered in a number of chapters. Right at the top of them, service delivery. So you'll hear the team sharing about how we will address some of their main concerns. We've been hearing them week after week on the radio station because we've already really started to share that early consultation with the public on the chapters in this 2025 to 2028 strategy on the Pulse radio show every Monday. We continue to do that yesterday, and you'll see it in some sections of the media, including CBC, where we talk about the health information system and the benefits that will bring to the public. Right now, everything is paper. Mr. Clark has decided this hospital needs to go paperless, saving us millions of dollars, but also making healthcare more accessible and at the fingertips of our patients. So it's just to allow the public to have a greater not only say in their healthcare, but better access across the board.
CEO, talk some more about these priorities that you're pursuing in this 3-year plan.
So the strong one that you just mentioned there is about digitisation and losing the paper. To be able to have the information on the system, electronic patient record, that's accessible to all the clinicians immediately. So somebody presents at the A&E department, we can immediately pull up the notes and see what's been happening. We can see if they've had any prior tests or diagnostics. We can save the money not having to repeat those. If there was a test done yesterday or last week, that's not required to be repeated. We can make decisions much faster on what that treatment plan will be. That information is available up to the wards if the patient's going to get admitted, so they immediately have the information. And also for the public, one of the things that we do here is often they're ringing up trying to find out information themselves about their own appointments, about their own healthcare. And if we build into the health information system a patient portal, they'll be able to book their own appointments, see when their next appointment is, navigate around the system to understand how they can best use that system. And it'll also enable them to see their own medical records. They can see what's happened, what tests they've had, what the results were. All that information will be made back available to the patients. So this will probably be the spine of the next 3 years as we build this around. Because having that health information system supports many other things. It supports us in quality, it supports us in waiting times, it supports many different things can come from that. The lack of real-time information and the lack of automated information is a real challenge if we're trying to do anything at the moment. Trying to get information takes so long. By the time we get the information, it's out of date, and we have to start trying to collect it all over again. Really interested in trying to improve quality. We've drafted a new quality framework, and we'll be launching that, about how can we improve quality across the organisation. How can we reduce those waiting times? And we know the pinch points, waiting times for the A&E department, cancelled operations for the electives. So we're probably aware of some of the key challenges, but it's important that we don't guess that we have it right. It's important that we hear from the public and hear what concerns them and hear what they want from their hospital. I do hope you're able to join us tomorrow night.
I certainly hope so as well. What I know for sure is we likely will have a camera, so even if I'm not able to join you live, I'll be able to view what you're talking about, because as you both mentioned, this is very important. It's important to every Barbadian. So the more that we learn about the plans moving forward, the more equipped we will be able to kind of engage with you to make sure we're getting the best possible healthcare options out there. And I know a lot of the times, Shane, we hear about the negative things that are happening, or we're looking at ways that we can improve on services and service delivery and the like. But what are some of the things that you've discovered that you're doing well that you want to carry through into the next couple of years?
I think medication delivery is right at the top of the list. People are very happy that they can rest at their homes and have the medication delivered to them instead of coming into what can sometimes be a crowded pharmacy, although some others like that. They like to come in and actually that's a meeting point for some individuals, have their discussions, have their daily outing, and then collect their medication and go home. Others, they prefer just to pay $10 to $16 and have it collected right at their doorstep. So that is one of the major wins for us. Another major win has been the public dissemination of information, the Pulse Radio show, and of course our media partners have been really helping us to get the information out there to the public. We have been sending out those notices, re-accident and emergency, and it's all about that public education. The public education is something that we want to continue to build on. I know the CEO has given me a mandate of making sure that we have that outlet, that we can have that outreach to the public. So that has to continue into 2025. And we really want Barbadians know, because this is their strategy, this is their hospital. The CEO has crafted the strategy, but they also have now their chance to give input. So when they come into the auditorium, they'll have their chance to say this is what they want to see. So if they have missed something in the strategy, if they see that according to them, something is missing, they'll have their opportunity to say, well, I want to see this in my strategy. Where it is in there already, we will point that out and we can make amendments going forward. I mean, I think I would give the CEO an opportunity to say how we will do that in terms of any amendments to the strategy if needed.
Yeah, absolutely. But just before we do that, you said about early wins, and some of the wins we've had already is we've developed a comprehensive governance framework which says how do we operate, how do we work, how do we make decisions. And alongside that, we developed a balanced scorecard which says, how are we doing? How are we doing today? How are we doing this week? The strategy is what we're going to be doing in the future. Those first two documents have allowed us to identify what some of the challenges are. And working closely with the Ministry of Health and Wellness, we've been able to secure additional funding, nearly 300 additional posts, additional capital expenditure, 125 million to be split over 2 years. So lots coming for us in that sense from the Ministry being very supportive of our developments. So I think when you can articulate what the requirements are and you can get the support from the leadership, we're really on a journey now to make some significant changes. We've recently celebrated 60 years at the Queen Elizabeth Hospital, and I always think that when they opened that hospital, what a big moment that was. And I think similarly over the next 3 years, we're going to see another seismic change in what's happening for the Hospital for Barbados. In relation to the feedback, we took the feedback from the staff and we capture all the feedback. It's important that if you give us feedback on what you want for your hospital, be that as staff or be that as a member of the public, it's important that we acknowledge that we've heard what you've said and we've identified where that fits into the strategy, or we've identified where it doesn't fit into the strategy, but what we're going to do with it instead. So as we're meeting tomorrow night, we'll give a brief overview of what's in the strategy, and then we'll invite the public to give some feedback as to what they've heard and what they want. We're going to capture that live as they're providing that feedback. We're going to capture that, identify whether it's already in our strategy and how we link that back to them. This is included in this objective, or identify whether it's a new one. When we did it with the staff, they identified things that weren't in the strategy. Now, that's really good for me because it just tells me that we can't think about everything all the time, and getting that feedback saying, what about this, is really important. And we're building that into the strategy now. We listen, we take that information and we use that information.
Of course, that's always important. A fresh pair of eyes can really bring a new dimension to something that you've been looking at for a long time and figuring that you're handling it in one way. But to be able to have the public come in and share and know that what they share will be considered in this way, I think will make a drastic difference.
Huge.
To whether people want to come out and communicate. Because often we hear about town hall meetings and there is a structure in place or what is supposed to be something very preliminary, but then we don't see how that information will be filtered and maybe used in going forward. So that's an important part of this particular meeting, and one which I think will set it apart in people's eyes.
Yeah.
And we even pushed it back, didn't we? We were due to have the town hall a little bit earlier, but we're speaking with the directors. They were suggesting that might be the wrong time. There's other things happening that week, and we pushed it back to allow additional people the opportunity to be engaged with us. So we listened. I even listened to my own directors. I wanted to get this the strategy consultation happening as soon as possible, but they were guiding me that the timing was wrong. There's other things happening that week. Let's push it back a week. So we listened. We've pushed it back a week. We hope as many people as possible can come and join us.
Okay.
Yeah, and that's what we really want, people to come out. We are trying to provide that live link for those who cannot, and more details will come on that. But definitely, we want people to come and just have their say, feel comfortable. Of course, we'll have some of our medical professionals going through some specific special things with them, so that will be a special treat to really get the meeting going. We'll have, of course, a word of prayer, and then we'll get the agenda started, looking at this strategy, looking at the components. The CEO will lead the way, followed by the directors, and then it will be time for the public to have their say, both there and possibly online as well.
All right, talk more about that format that it will take. So it's in a hybrid format.
We're working on the other side, the hybrid format, bringing it to people virtually. So we're looking forward to, or hoping really to have that component. And once we do, we'll announce that through our socials and our website, so people can continue to connect to QEH Connect, www.qehconnect.com, to see when that goes live. And also our socials on Facebook and Instagram under that QEH Connect handle. But just as I said, we'll try to get into that strategy. It's a 2-hour meeting from 6 to 8. So just come, spend some time with us as you have your say about the future of your hospital.
All right, excellent. I certainly look forward to that. And a little off script. Today is International Day of Persons with Disabilities. Any special message from you for this international observance, CEO Clark?
Absolutely. I mean, we're a large organisation and we should do more to employ people with disabilities and support people with disabilities. So I absolutely understand our responsibility as one of the largest organisations, if not the largest organisation in Barbados,
2,500 strong,
to lead the way with supporting people with disabilities, both through healthcare but also through employment.
All right, well, thank you both for coming in, and make sure that you make it out to that town hall meeting tomorrow. Very, very important. Again, it's coming off at 6 o'clock at the QEH auditorium. You'll get to engage with the CEO himself, Of course, Shane will be there, and many other players from the hospital as well.
Morning, morning, morning. Good morning.